Hello and welcome to the Brian Grant Foundation's Wellness Webcast, sponsored by Am Neal and Kiowa Kieran. I'm Amy LaValle, your community liaison and host. Today we're going to learn how physical, occupational, and speech therapy can support people living with Parkinson's, and how these therapies can address one of our frustrating symptoms, fatigue. We have invited three specialists to join us to discuss this topic. Lauren McIntyre, clinical advancement lead physical therapist practicing outpatient neurological therapy at Providence St. Vincent. Amy Dodson is an occupational therapist at Providence St. Vincent Medical Center who specializes in neurological diagnosis, including Parkinson's disease. And Julia Robinson, a speech language pathologist and part of an outpatient neurological team at Legacy Emmanuel Center in outpatient neurological rehabilitation. Thank you for joining us today. This is an important topic, and I'm so excited to learn more about how your areas of expertise can help us. Now, before I hand it over to Lauren, I just want to remind all of our viewers that feel free to ask questions in the chat box, and we will get to them at the end of the presentations. So Lauren, thank you for joining us today. I'm going to hand it over and let you take over.
Yeah, thank you so much for that great introduction. We've got a lot of information to share with you today, and we'll be taking questions at the end. So we'll go ahead and begin. If you could pull up my slides for me, please. Okay, and so I've just got some contact info there as well. I work at Providence St. Vincent, so lauren.mcintyre@providence.org if you have any follow-up questions, and then we'll go ahead and dig in. So a lot of you probably know some of this information, but I want to just zoom out and do a review of what we're talking about when we talk about different symptoms of Parkinson's disease, because understanding where fatigue is really coming from will help arm you with some information about how to deal with it. And there's going to be some elements that you're going to learn some great tips today of what you can do. And there are some elements that might be a bit out of your control. And so just knowing, I have ownership over this, and this is something that I'm dealing with, and I can't control all of it, and why that is sometimes can be empowering. So if we just zoom out, the main issue at the end of the day with Parkinson's disease is we're talking about neurons in the brain that aren't producing dopamine as well, or those neurons are being damaged that produce dopamine. So if we think about dopamine, it's transmitting signals. That's its main job. And a lack of dopamine leads to a lot of the decreased movement associated with Parkinson's disease or the other symptoms that we'll get into. Of course, today we're talking mainly about fatigue. And another thing to keep in mind is it's mainly affecting automatic movements. So you may have noticed someone is having trouble standing up from a chair or walking or buttoning a shirt, things that we normally do without thinking about it. Whereas if you try and really focus on something and give it intention, you can move a little bit better. So that's just one context to have as we're talking about fatigue today. Okay, next slide, please. And then another important thing to know about dopamine is it's not just the movement center for thinking about feeling weak or tremor or shuffling of gait. We also know that in the front of our brain, dopamine really affects our attention. So learning attention or kind of navigating obstacles around you. So just know that those are things that are affected potentially. And when those things are affected, being able to take attention back and forth, or noticing things around you, navigating a busy environment, that could take more energy from you if that is affected. Next slide. Now, this piece was newer to me. I'm always thinking about the dopamine pathway, but there's another pathway in the brain that we now know is affected, and that's the serotonin pathway. So no need to kind of memorize all of what's happening in the brain over here. I just enjoy giving people visuals. And the visuals are just to kind of show, wow, our brain is so complex. There's so many different pathways. There's so many ways that the brain is working together. And so the serotonin pathway, we're now thinking that that's more the issue for people that are having issues with sleep, pain, fatigue, mood issues, that perhaps it's that pathway that's kind of causing those symptoms. And then it's the dopamine pathway that's having more of the issues that we think of as the physical. Okay, next slide. So if we zoom out, we're talking about motor symptoms here. The next slide, we're going to talk about non-motor symptoms. And big picture, fatigue can kind of come from all these different areas. So motor symptoms, not everyone has all of these, but different people have different varying issues, but we're thinking tremor, rigidity, kind of smaller or slower movement. Okay, next slide. And then non-motor symptoms, some people are dealing with more or less of these. And again, we're thinking that might be due to that serotonin pathway in the brain. So loss of smell, depression, fatigue, apathy, that whole other list and host of symptoms, anywhere along there. Okay, next slide. So in general, how many people are dealing with fatigue? I took a look at the literature, and it's about a third of patients rating it as their most disabling symptom. Well, a third of patients are having fatigue, I should say, and then over 50% are rating it as their most disabling symptom. So the bottom line is it's a huge issue for a lot of people in the setting of Parkinson's disease. Next slide. So again, the serotonin pathway, those are the ones that we're thinking are most related to the different symptoms here. So something that's interesting in the literature is that what they found is fatigue is a separate issue, kind of because of the brain not working as well here. So there was some research that's saying, well, is fatigue, secondary to the fact that people feel like they're not moving as well? Are they getting weaker? They're not exercising as much. Is that why they're tired? And the answer is actually no. So regardless of how involved your strength or your movement is, fatigue was still something that was present for people. And it's also often a really early symptom before people have a lot of movement issues. So it's not just tied to movement. Then they looked at studies about sleep. Is it because people aren't sleeping as well? And it actually was still its own separate issue. So people had poor sleep and had a lot of fatigue, and people had good sleep and had a lot of fatigue. Now, one does inform the other. That's where it gets tricky. But again, fatigue is actually still its own thing, kind of coming from the nervous system and not just a side effect of these other things. And so that was really interesting for me to look at from the research to see. And then lastly, they looked at, is fatigue related to Parkinson's disease medications? If you look at most medications, there's a lengthy list of side effects. And the answer again was no, it was a separate issue. Okay, so next slide. So kind of a summary, it's its own distinct side effect potentially from Parkinson's disease. It is really commonly associated with depression or sleep issues, but can be its own separate issue. There is a higher association with people that have cognitive issues. And then the only other thing I saw in the research about, gosh, what is causing this, is there was some relation to maybe metabolism changing, inflammation changing, and maybe the endocrine system. So just kind of all these little ways that Parkinson's is affecting the brain might be kind of affecting these other symptoms, and then it all comes together to give you this overall fatigue that you're dealing with. Okay, next slide. So we'll be talking a lot today about how do I deal with it? So it's always good to rule out other secondary factors, talking to your primary care doctor or your neurologist. So is there untreated depression? Maybe some of my fatigue is coming from that. Talking to your doctor, what does it look like to address that? Are there sleep issues? Are there pain issues that need to be addressed that are maybe more of the drivers? Some of the literature talked about really working with them to optimize your meds. So there was some evidence for stimulants, antidepressants, levodopa, other dopamine agonists. So doing a check-in, are my meds really optimized? Are stimulants or antidepressants something I should consider or not, based on my different health issues? And then we're going to learn about strategies today from my colleagues, OT and speech therapy, and then exercise. So that'll be what I kind of dig into now that we've had this intro. I'm going to keep it pretty basic, just going over some topics of exercise, because I know that you guys have some great resources on some other webinars. So we'll kind of keep it more to big picture versus specifics. So we'll go to the next slide. So just some tidbits from the research. Big picture, exercise is helpful for all of us as human beings, but especially in the setting of Parkinson's disease. So we know that it improves strength, balance, walking speed. And we know that people that have a more sedentary lifestyle are more prone to fatigue. It was interesting that exercise alone was not the only thing in the research that was helping people with fatigue. Again, it comes back to it's its own issue coming from kind of brain dysfunction. But we do know that if you're deconditioned, you're way more likely to be fatigued. And we do know that exercise improves the way your brain uses dopamine. So whatever amount of dopamine your body is still producing, you're going to be using it better if you're exercising regularly. And then hopefully that translates to one factor contributing less to fatigue overall. So these are the different parameters that we'll talk about. This is from the Parkinson's Foundation, so you can always go to their website if you want more details. And these are the 4 categories. So we'll go through each one together. Okay, so if you go next slide for me, please. So aerobic, if you're worried, or not so much worried, if you're dealing with fatigue, this is the big area to focus on if you don't feel like you have the energy for all the categories. So aerobic exercise, a goal is 3 days per week, moderate intensity. So just think if 10 is the hardest I can work out, you're shooting for about a 4 to 6. 30 minutes is ideal, building to 150 a week. And you might not be able to start there, but anywhere you can start is beneficial. So exercise, when it's aerobic, it's giving us better use of the dopamine we have, and it's giving us better use of the oxygen we have in our body. And that is going to help overall with our body just being more efficient and less fatigued and tired. So this is where I would put most of your effort if you're not sure where to start. And again, it's got to be moderate. It's got to be winded. There's got to be some effort. You can still talk. You're not so winded you can't talk. But if it's just kind of light, seated biking, slow walking, it's great for your body as far as bone density, heart health, but it's not giving you the benefits that you'll need for fatigue. Okay, so we'll go to the next slide. Strength, 2 to 3 days per week is their recommendation, not something you have to do every day. We're not going to go through all the details again here, but the big picture is stronger muscles will make you more efficient so that doing things are less tiring, like getting out of the car, standing up from a chair. And you have to overload muscles and actually to get stronger. So if you've been doing an exercise program for a while and it's fairly easy, you're probably not building strength. So you have to overload the muscles a couple times a week and give them rest days to actually get them more robust to make your movement easier. You have to kind of get that muscle burn going. And so if you're not sure, that's where a group class, PT, athletic trainer comes into place. Okay, next slide. Balance is is a huge area in this population just regarding fall risk. But as far as fatigue, if you're having to think really hard about all of your movement, that's going to be draining. So that would be an indication to reach out for a therapist to get a balance program going. So if your strategy to deal with imbalance is, well, I'm really careful, or always think about what I'm doing, or always watch my steps, probably isn't a practical strategy, because we know walking is actually automatic and it's really taxing to think about every step. It's really fatiguing for the brain. So if you can get that balance better by working on it, then your mind is a little bit more free for the other things we usually do when we're walking. When we're walking, we're usually thinking about what we're doing later that day, or where did I leave my keys, or something like that. So that's a huge area that if you can uptrain it, it can take some cognitive load off of your brain. All right, and then next slide, flexibility. It's just something that helps you move more easily and readily. Personally, I like to combine it in some of the aerobic exercises or some of the balance exercises, so that it just makes less things for my patients to have to keep up with. But some people are more affected by rigidity than others. And so if you're trying to move against a really tight or stiff muscle, that's just another thing that's draining. And so for those people, perhaps really focusing on stretching more than strengthening is helpful for them. Again, what can you take off your plate? Is it that you're thinking about your balance all the time? Or is it that you're working against these rigid muscles? You know, let's start there. Let's pick one category and kind of go after it. Okay, next slide. So those are some references, and I will be turning it over to my colleague, Amy Dodson, occupational therapy, and she'll take it from there.
Hello, my name's Amy, and I'm an occupational therapist. And occupational therapy, what we do, big picture, is to help people become more independent or participate in the things they want to do, those functional tasks. So for Parkinson's disease, it could be working, it could be writing, dressing, showering. All those activities, an occupational therapist will help make that easier or help improve the independence. And so next slide, or first slide, I should say. And next slide. And so we're going to be talking about tools. And the first, because anything little that we can build up with multiple things, they're all little, but they add up to create a better day and hopefully be easier to do the day. And we're going to start with pacing. Pacing's a strategy. These things listed here are common sense. They're not rocket science, but it's something we don't think about and necessarily implement. It's good to talk about, to see how can I implement this in my life, because for you all, your reserves are limited and you recover more slowly. So we have to look at our day knowing that information. So I tell my clients, hey, it's like you have an old cell phone battery. The cell phone battery never gets a full charge and it depletes more faster. So we have to be realistic and really plan for that. So number one is knowing your limits and respecting them. First step, know your limits. And this could change over time. Hey, before I could do 3 major outings in a day, but now it's wiping me out. And so adjusting from there out. Sometimes it's maybe hard to know what your limits are until I always tell people, hey, if you get really tired, reflect. What did I do yesterday? Is there something I could change about yesterday? Because the overall goal with this is to have control. So we're not having to cancel things. You know, we have more control of our day, of our week. And for some people to do that, they may need a monthly calendar resolve to see how many appointments they have in the week, haircuts, etc. Other people might need more, like a weekly calendar or even a daily to plan out. But what we're trying to support is for things you want to do. So if I have a grandchild's birthday party on Saturday, I want to have a good day. So I want to make sure I don't overdo it on Friday, and I want to plan that out. So we have to prioritize. And when we kind of know our day, it's easier to communicate with other people also. So if I have friends invite me, for example, to the mall and for lunch and shopping, and I kind of already know, gosh, that sounds like an awful lot, but I say yes. And then I say after lunch, I think I'm going to go home. That's, the peer pressure kind of builds up because they want you to have a good time. Oh, there's a bench across. You can rest. Come on, we want to show you something. But people tend to do better when it's known ahead of time. Hey, I can be there for lunch, but I can't go shopping afterwards, but I'm excited to see you for lunch. You're kind of setting those boundaries, which are meant to help you. But back to number 1, respect them. Knowing your limits and respecting them are 2 different things. People can know their limits, but still want to push through, especially people with what we say type A personalities. They're going to make sure they get it all done. And you have to trust the process if you're type A, that you will get things done. But respecting them, a lot of people, especially the real, greatest generation or baby boomers raised by the greatest generation on, hey, resting is lazy. Come on, pick it up. You can't be lazy, this whole work ethic. And what we're saying is, hey, respect that. It's okay to take those rest breaks and to do what you need to. And if you're having trouble giving yourself permission, I give you permission. Your therapist give you permission. I'm giving yourself the allowance to rest. So number 4, routines. Routines, hey, we don't want to have to think about everything when we wake up in the morning. Routines are good. Waking up similar hours, going to bed, having your meds similar hours, your meal times. We don't want to, when I go to work, I don't think about everything I have to do for work. I do a certain routine in the morning to get myself ready. So that decreases that cognitive load of having to think about everything. But delegating is one option. When they did a study on spouses, what they thought, and the person with Parkinson's, what they thought over tasks that were struggling to the person, the spouse thought, oh, they need help. They're really struggling. But the person with Parkinson's thought, hey, I'm doing this. I'm doing well. And so we want people to be independent and participate. But I would suggest paying attention to your spouse if they're saying, wow, you're really struggling. Is this something you want to do? And maybe it's not something you want to do. Do you have to wash the dog? Is that something that's important? Or put on the jacket? Jackets always seem to be the hardest. And if we live with someone, maybe that's one thing we delegate. Scheduling daily rest periods. Some people actually have to write this on their calendars because it's just so easy to skip because the day can fill up. And if you're not working, maybe after lunch, taking an hour break, especially if you're not sleeping in a bed and you're sleeping in a recliner, maybe that's a good time to lay down in a bed to rest. If you are working, making sure you do take your breaks and your full lunch. Could you go to the car and rest, or is there a lot of bigger places now might have a rest room for you to take advantage of. So this also applies, all these tips also apply to vacations. It's very common to want to feel like you have to be on for a vacation, even though it's meant for relaxation. And again, I encourage people to communicate ahead of time with the friends they're going with. We're in Oregon, so it always happens to be Hawaii that people feel they have to be on for. And I say, just tell them, hey, I take a rest break at 1:00 every day. I'll be in my hotel room. That's what I do. You guys, you do what you want to. Because people around you, again, want you to have a good time. And not everyone understands fatigue. And that's okay. They might not get it. But you know your body, and it's okay to advocate for that. Don't rush. Rushing wastes energy. And rushing can come in different ways. We're standing in the grocery line, we're trying to find our money or our coupons, and now we're rushing. Now we're getting anxious. We're holding our breath. It's just, we're wasting energy, adding to fatigue. It could be getting ready for a doctor's appointment. Avoid the 8 o'clock doctor's appointments. Harder in these days. Sometimes that's all you can get, but we want to make sure we give ourselves the time to get ready or to prepare ourselves for that next task. Working on breathing. There's many simple breathing techniques. If you're in that mode of, I'm starting to get anxious because I'm rushing, to kind of calm the system down. A simple box breathing is very effective. 4 breaths in, you hold your breath for 4, you breathe out for 4, and then you hold it for 4, just to calm the system down. Some of you out there might know the story of the spoon theory. It's an excellent story. You can Google spoon theory and it'll come right up, but it comes from a website called butyoudonttlooksick.com. And it's a woman with a different diagnosis, but it was her way of explaining to her friend how she had to manage her fatigue and plan. And she saw spoons at the dinner table, and that's how she kind of incorporated it into her story of, I only have so many spoons a day, and I have to protect how I use these spoons. I had to plan it out and prioritize. And I will say that families tend to get this. If there's anyone that's not understanding, it's a very concrete story. It's understandable. I've even had little children get this, where a 6-year-old was saying, Mom, are you out of spoons today? And so families, to help support you, can get that one. Next slide. So another tool is just modifying the activity. If showering is very exhausting for us, hey, can we sit for that activity? Can we sit if we're participating with laundry, just to fold it? Sit in the morning to cut the food for later in the day. We can modify the actual environment. Hey, we've always had that heavy pan down below, but it doesn't need to be there. I use it frequently, so I'm just going to keep it on the stove so I don't have to be lifting up and down. Looking at where our shoes are. Oh, the shoes always get under the bed or in the bottom of the closet. Can we make a shelf or have a shelf that's higher to have our shoes? So we just reach kind of at waist level. Think about waist level being an easier way to access items. Anything above our heart or anything where we have to bend over kind of affects our breathing too, compromises us in both ways. Adaptive equipment, medical equipment. I will say that there is tons of equipment these days. Someone has made something literally for everything. But if it doesn't answer the question of, does it improve independence? Does it improve ease? Does it decrease pain? It's just going to wind up in a closet somewhere and you're not going to use it. So really, some people that can be valuable to go in to see a therapist. You can try it out to see if you like it. But there's equipment for everything these days, from dressing, bathing equipment. It could be, I'm going to use a long handled brush I can get at the regular store so I don't have to bend over. It could be at, shoe tying is exhausting and it's going to buy elastic shoelaces, or there's so many shoes now for everybody they can just put their heel on it and it pops back up. So they don't even have to have elastic shoelaces. It could be rails in the house. One thing that I like is the car handle. So if I know using a grab bar helps or arms on a chair helps to stand up, I'm going to use this car handle that goes, when you open the door, it goes right into the latch. And now I can use that like a grab bar, and I can push right up. So I'm not wasting all this effort of multiple trials of trying to get out of the car. Number 4, timing of an activity or a medication. So a lot of people, especially those who know their on times and off times, knowing, hey, for example, I'm good 45 minutes after I take my meds. That's when I'm going to do my self-care routine, my shower, getting dressed. And then timing of an activity. Hey, if I'm not doing well in the morning, adding a shower in the morning, I'm going to do my showers at night. Number 5, change, delete parts of the activity. if you have an activity that's particularly hard energy-wise, ask yourself, how can I change it? Is there something I could do differently? So if grocery shopping is difficult, I'm just going to make sure that they put the perishables in one bag and the non-perishables in another bag. And when I get at home, I'm just going to bring up the perishables. I'll just leave everything else in the car and I'll have someone else do it, or I do it later. Maybe I was raised to do my towels every 3 days. Do I need to? Can I just change that? Next slide. So this is just a slide to remind you that if there's any movement strategies that's helping you, and I'm going to use the one for bed mobility, getting out of bed. If there is something your therapist has taught you or that works for you, and that could be a cue card next to the bed that this is how you get out of bed, thinking about each step, or is it imagery, or are you using an auditory cue to yourself on the steps of getting out? You want to use those things that you've learned in therapy. So it's just not repeat, oh, I forgot my strategies and now I'm trying to get out of bed and I can't. And now I keep doing the same mistake twice or trying another way. No, we want you to know your strategies and what works. So you don't have to avoid that wasted physical effort. And then I also have avoid multitasking, because even though you work with multitasking with PT and your physical trainer, when it comes to function, we want your attention on the task. So if you're getting ready in the morning, that listening to that news program will actually impede your fine motor skills. If you're eating and eating's really hard right now, maybe everyone knows at the dinner table that we don't talk. Yes, it's nice to talk, but maybe you need your focus and you can't multitask in that way. It needs your full attention. Next slide. And this is for people who are working, and this is in the United States. It's called the Job Accommodation Network, and I have the website there. They help people with workplace accommodations, incorporating the American with Disabilities Act to know their rights, to have ideas. They work both with employers and employees. And they have a diagnosis, and Parkinson's is one of them, where you just choose it. And it has all the issues that Parkinson's may pose. And one of them is decreased stamina fatigue. And then you go hit that button, and then they have some ideas on, okay, here's some ways to address it in the workplace that would be considered reasonable accommodations for your employer. They will consult via phone or online. And even though they don't have legal power, they do a good job of helping you advocate. They're a good company. They're federally funded. And that is it for OT at this time. And I'm going to pass it off to our speech therapist, Julia.
Thank you, Amy. Hello, I'm Julia Robinson, speech therapist at Legacy Emmanuel. Thank you so much for having me today. I'm going to be talking about the role of speech therapy with Parkinson's and the treatment that we can do to help cope with fatigue related to swallowing, speech and voice, and cognitive communication skills. Next slide, please. All right, so first let's talk about the role of fatigue with swallowing. I'm going to go over some reasons why you might be having trouble swallowing, and then some tools related to fatigue, what you can do. You might have less efficient, jaw and face muscles. This can affect the control you have over chewing and swallowing. It could take longer to chew, be more difficult, and cause fatigue. You might have problems with your throat and tongue muscles, causing a weaker or delayed swallow. You might have slow muscles carrying the food down your esophagus to your stomach. You might have dry mouth, or on the opposite end, excessive saliva and drooling. Or you might have practical problems with eating and drinking, such as difficulty getting the food to your mouth or trouble balancing the cup, holding the cup, excuse me. Next slide. All right, so swallowing at mealtime is an endurance task. It involves attention, repetitive movements, and many muscles in our mouth, throat, and respiratory system. When your endurance is impaired and you're tired, it can negatively impact your swallowing. And it can increase your risk for aspiration, meaning it can increase the risk of food and liquid going into your lungs, which we want to prevent because we want to prevent any type of infection and, of course, prevent something severe such as pneumonia. So when your endurance is low, it can also, and you get tired with eating, it can cause you to stop eating early, limiting the amount you take in. It can result in weight loss or increase the risk of malnutrition and overall poor quality of life. Fatigue can also cause difficulty with concentration, making the act of eating so much more challenging. Next slide. All right, before we go into some tips with safe eating and drinking, I would certainly encourage you, if you are having trouble swallowing, to get a referral from your neurologist or primary care to see the speech therapist in your health system, to have a swallow evaluation. We often do modified barium swallow studies, which are moving x-rays, so we can actually see what's happening in your mouth and throat when you swallow. Make sure the food and liquid is not going into the lungs. If it is, we have various strategies we can try to protect your airway and determine the safest diet and precautions. We can also go over exercises based on your swallow test to help strengthen the muscles for swallowing. Excuse me. So some tips to think about for safe eating and drinking. 1, consume smaller, more frequent meals. Many people with Parkinson's report they fatigue with a bigger meal. They're fatigued by the end of the meal. So instead of having 3 large meals a day, consider having 5 to 6 smaller meals spread out throughout the day. You can modify your diet. Going back to what I said earlier, if you have trouble with chewing, maybe having softer food is going to be easier and not take as long. We also, can recommend after, like I said, the swallow study, what is the safest diet for you? Excuse me. So taking smaller bites, smaller sips, being careful with straws. Take your time. If you are tired and it's almost mealtime, wait a little bit before you eat. You don't want to start your meal when you're already feeling tired. Excuse me. Reducing distractions when you eat and drink so you can concentrate on being safe. And if you tend to get tired in the evening, which most people do, consider having your last meal earlier in the day before you hit that wall, before you're too tired to eat. All right, next slide, please. Similar to swallowing, speaking requires a lot of energy. I'm sure you can think about a time when you've given a talk or you've been at a dinner party or having a conversation that went on and you're talking for long periods of time and it's tiring. So let's go over a few tips for talking and managing fatigue. Try to determine the time of day that your speech is best and plan your social events accordingly. So if you're better in the morning or early afternoon, instead of having people for dinner, have them over for lunch. Have short voice rests. Plan periods of rest before you have a phone call or before you have a conversation. Know that fatigue can significantly affect your ability to talk. It can affect the clarity of your speech, making it harder to understand, and it can also affect your voice, the quality of your voice. So having short rest breaks is important. Excuse me. It's also helpful, I'm not going to read through all the things here, but to make sure that listener can see your face. Look at the person while you're talking. It's best if you can be in a well-lit room to increase the ability of being understood. Next slide. Okay, so I wrote down a few low-tech and high-tech ideas to use as emergency backups for communication when the fatigue is high. So I'm thinking of this in terms of if there's an emergency and you needed help, what could you do? So low-tech device would be pen and paper where you would write something or you'd already have something pre-written on a piece of paper, having a card in your wallet with all your contact information that you just have to point if you needed help, someone call for you. Bells or buzzers to make noise so people can hear you. And then, of course, high-tech devices, the life call system, that's there's many of them out there, but that's one that you wear around your neck and you press a button and you get an emergency response team if you needed something and couldn't make the call. A personal voice amplifier. I'll show you one later that I have, but you can use, a portable amplification device when you're having trouble keeping the volume up. Some people use it at home or work or social situations. There are ways that you can pre-programmed scripts in your phone if you're having a hard time communicating, where you just press a button and it says something for you. You can use various text-to-speech apps. All right, next slide. Finally, let's talk about cognitive communication skills or brain skills. When you have energy, that is the foundation for being able to quickly process information, pay attention, switch your attention back and forth, remember things, learn new information, stay organized, plan, make decisions. But when your energy is low, when you're tired, thinking and doing all those things are more difficult. There are other factors such as pain, variable or lack of sleep, stress, anxiety, depression, nutrition, which of course can also play a role in your overall energy level. Excuse me, next slide. All right, so similar to what Amy talked about with the pacing, in speech therapy, we talk a lot about having these short brain rests. And one of the big ones that we like to go over is diaphragmatic breathing. So when you're taking a big belly breath versus a chest breath or doing clavicular breathing, which is not as efficient, when taking a big belly breath, it helps stimulate the vagus nerve, it activates the relaxation response of the parasympathetic nervous system. And the main purpose of that system is to conserve energy and regulate body fluids. So I know it might sound basic, the breathing, but it's really a great way to recharge. So what we often recommend is scheduling these rest breaks throughout the day or in between activities. You sit in a comfortable position, you sit upright, you close your eyes, and you do a minute or two of relaxation, of deep breathing, so diaphragmatic breathing. So you can put your hands on your abdomen, you take a big breath in through your nose, focusing on expanding as you inhale, and then exhale through your mouth with a shh, and the muscles in the abdomen contract. And trying this for a few minutes with your eyes closed a couple times a day. It's a great way to recharge your brain battery. Excuse me. Okay, let's go on to the next slide, please. Some other communication tips to use when you're tired. Planning ahead, carrying a notebook, a 3x5 note card with information that you need, reducing distractions, quiet environment like we talked about. having scripts prepared to what you want to say, some common things or common responses. Being aware of your posture so you have good breath support to be able to use a louder voice. Next slide. All right, and finally, when you're tired, when you have fatigue, you can have brain fog and have difficulty with thinking and with remembering. So having some tools to help you is helpful. I'm going to have Gavin, if you could show me for a minute so I could brought a couple things for show and tell. Okay, so a few memory tools that we recommend often are carrying a small pad of paper in your pocket to write things down, having a emergency card, laminated card in your wallet. We often will use alarm reminders. So there's various, you can set it on your phone. We like these. There's several different ones out there, but it's for your pills. And there's an alarm. It'll remind you to take your pills. That's a nice one. Having a to-do list or checklist. And then certainly that's so much what Amy had talked about earlier, having that routine, that structure, the same thing over and over helps you remember things. There's been a lot of research over the years about writing and helping you remember. So that act of physically writing sends a message to your brain. So you see it, you write it, and it helps you remember. So I'm certainly a big fan of writing things down, more low-tech things, but there are many other options that are high-tech on phones to keep track of things. A lot of people use Google Keep or other apps on their phone to track things, or note section. And I'd say it really doesn't matter if it's low tech or high tech, as long as it works for you, that you can, are consistent and you stick with it, be the key. And then you can go back to the slides, please. Thank you. Oops. There's another. Okay, and then just general brain health to wrap up, making sure you feed your body, that you're eating right, you got good sleep, you socialize, obviously exercise, the physical piece that Lauren talked about, and then doing a variety of cognitive tasks each day to keep your mind active, to exercise your mind. All right, next slide. Oh, I guess that's my last slide. Well, that about wraps it up for my part. I hope I was able to give you some tools to deal with fatigue and swallowing, speech and voice and cognition. Please feel free to email me if you have any specific questions. And thank you so much for having me.
Thank you all very much for the informative presentations. I appreciate it. We got a lot of good tips and info. I have a list of questions, and I've got some questions that came in through the chat, but a reminder to all of our viewers, if you have any questions, now's the time to put them in the chat box and we'll get to them. I'm just going to open these up to everybody. But first, what is this? Is there a difference between fatigue and tired? Because I feel like we use that maybe interchangeably. Is there a difference in that concept or that definition?
I guess I think of them as the same. It's funny, there in some of the articles I found, there was a definition of fatigue, and I wish I'd saved it, where it was like spelled out what they were talking about. I think in terms of, we think of fatigue as when it's affecting quality of life, it's an issue. So some people might just run more like hypo versus hyper and just be more of a tired person or need more sleep in general. But when we're talking about fatigue, we're talking about an energy issue that is affecting your quality of life, is how I think about it.
So one question that came in is, you all mentioned a daily rest. is that daily rest the equivalent of a short nap, or is just sitting and being quiet the same? Is one better than the other?
It depends on the person. It can be either. It's just recommended that it's not watching TV. That wouldn't be considered a rest. It truly is getting away, maybe to the bedroom or quiet room. It could be resting, or it could be an actual nap where you fall asleep. Some therapists have recommended even doing an hour. So if you can fall asleep, to do the full REM cycle, to get that rest. You just have to be careful of that's not going to impact going to bed at night, would be the only issue.
And sometimes fatigue during the day causes an excess of napping, so like over an hour, and then people have a difficult time falling asleep at night. So another thing I had seen for people that are tired during the day but not sleeping at night was, especially in the Northwest or other northern areas, is looking at getting an indoor sunlight, that perhaps you're not getting enough light exposure that is triggering you to actually feel perky and awake, and that can help you not overly nap and get a better night's sleep. And if you do get it, like what they call the happy light or whatnot, you really do want to look up how you're supposed to use it, because you can't just have it on at a distance. It's really got to be within 2 feet of you. It's got to be touching skin. And I think there's a certain amount of lumens that has shown that is more useful than others, but that's an effective tool also.
If you all were given just one thing to change in our daily activities, that would be kind of the easiest but the most effective, what would you do
Probably
to help mitigate fatigue?
Probably pacing. What do you think?
Planning.
Yeah,
Planning.
pacing, I agree.
All right.
Aerobic exercise would be a number 2. But should I be?
That brings me to another thing, exercise. We're in the middle of cold and flu season. And if you have kids like me, that means it is just nonstop colds that take forever to recover from. What kind of exercise would you recommend? Because I feel lousy. I can't do what I need to do, but I also don't want to fall off the cliff of not exercising.
So we're so fortunate with YouTube. There's so many guided exercise programs. I know the Brian Grant Foundation has some exercise videos online. I also really like Parkinson's Wellness Recovery Group. They have a seated or a standing exercise videos that you can follow along with. And even the seated one will give you aerobic exercise as long as you're moving quickly enough. I also really like Fitness Blender. It's just free exercise videos online, but if you look at Fitness Blender Easy Aerobics, they have like an indoor stepping program where you're stepping different directions and it gets your heart rate up. Doesn't require too much balance, but then they have more advanced ones if you want something more challenging. So those are my 2 favorites. And sometimes people are like, I'm confused that you're telling me to pace, but then you're also telling me to be more active.
Mm-hmm.
So the way I think about it is, you have a savings account, you've got dollars to spend, or the spoons. And so exercise is going to help you run more efficiently, like you're saving. It's like you're earning more interest. You're going to run more efficiently, save more energy if you're stronger and aerobically fit. But that still doesn't mean you can just go spending those bucks everywhere. You still have to look at what you're spending each day and make sure you're not emptying the account.
Julie, I've got a question. You mentioned fluids, drinking when you get the fatigue in your throat. Is there a better type of fluid, water versus tea, or warm versus cold, room temperature? Is there something that would be more helpful to us during those times?
Oh, in terms of with voice and with speaking, how it's just for good vocal health, it's important to stay hydrated. Whatever feels comfortable to you, whatever you like. It doesn't really matter if it's hot or it's cold or room temperature, whatever you like. Just to, like right now, I can tell that my voice is getting a little bit hoarse. So having something to sip on throughout the day, especially if you're talking a lot.
So when you're sipping, so that's my question, is just anything wet, or does temperature matter?
No,
Okay.
I don't
And
see
then
it does.
finally, I just wanted to we're getting into the holiday season where we are going to be getting together and eating and socializing and talking, and that can be really exhausting. So how should we prepare for that? Sorry, I'm getting a little distracted. My dog just came in. Some of those are going to be in the evening, in the afternoons when you are tired, and you're prepping the cooking. And so, what would you recommend for the holiday season of really preparing yourself to be cope with that fatigue?
I think a lot about what Amy shared, and she can add on to this, is the delegating. Because I have patients that are like, I haven't done my exercises in a week. I had 3 dozen cookies to send out. My son always gets some, and then I'm going to be doing this and that. And it's really hard to let go of rituals, especially if they're important to you or you're someone that enjoys setting up the tree or doing the cooking or hosting. But being flexible to changing those things, to be able to delegate or say, maybe someone should be sending me cookies this year, and just switching it up to really say, is this reasonable?
Mhm. Or plan ahead, freeze stuff. Someone in the chat said catering, if that works for you, great. Easy button, Costco.
Or buy the dough that's pre-made and you just have to slice it and bake it, right?
So, and then to expand on this cognitive fatigue, when you're talking, there are times like I'm just getting tired and I can't focus on what somebody's saying to me anymore. Is there a tip or a trick to, snap back into it? Or do I just say, I'm sorry, I'm losing concentration? And then is there a way to get a burst of energy when you're in the middle of this fatigue?
Yeah, it's hard, especially if it could be in a short conversation or in a long conversation, but I'd say, if you can't, obviously, if you pause and zone out, you're going to miss the conversation. You can't do that. But at some point, you just try to get through it if you can, but then you might have to say, you know what, I'm going to have to take a little bit of a break now. And then you're talking about the holiday time, could you plan, if you're in charge, could you plan a party for earlier in the day? Could you have it so you don't have background music on like maybe you normally would at a family gathering or whatever, but just kind of think about ways to not have as many distractions so you're able to have the conversations that you want to have and plan it for shorter periods of time. Maybe Amy sorry,
No,
want
you're
to add
right.
anything?
Yeah, I also think it's about like the energy dollars. It's, if you spent the bank account is probably empty at the moment. And it's going to take that time to recover. And a lot of us, to what Amy was speaking about, are sort of in a high accomplishment. Like what I get done is kind of where I get value mentality in this era. And I think there's a cultural shift outside of Parkinson's of valuing rest and valuing people speaking up for themselves. And sometimes it just takes practice to be like, well, I used to do X, Y, Z in this amount of time. And even 3 months ago, that was okay. And it's like, well, was it really okay? Or was I just getting by the skin of my teeth? Like, should I really have not scheduled that coffee with my friend after I had X, Y, Z already to do? Like, can I stop before I'm wiped out? Can I hydrate before I'm dehydrated? That kind of thing.
And I want to add something. We can't always plan for the best. Sometimes things happen. Like it could be I have to go to a funeral and it's in a different state, but I really want to go to that funeral. And while I'm at that funeral, I have to be on and I'm standing more and it's a long day and it was a long drive. And you know what? You go to that funeral, even if you can't pace, but the next day, you're not going to have your PT appointment the next day, right? Or any big appointments. It's going to be a rest day and you might need more than one rest day. So we can't always plan for it all, but we're trying to have a base pacing plan though.
That's good.
These are some great tips and tricks and advice. And, I think some of it is so common sense, but it's just so hard to put into practice. Being a mom of young kids, it's like, All right, I want to do it all for them, but yeah, hard to put myself first and prioritize. I want to thank everybody. We're at the end, so if anybody has any questions, please follow up with email, and we will try to get the recordings out to you and hopefully the slides out to you. I want to thank everybody for joining us. And again, Julia, Lauren, Amy, thank you for taking the time to share your expertise and knowledge with us.
Yeah,
And I
thank
hope
you.
everybody has a great day.
Thanks so much.
Bye.
Bye.